For local treatment, keratolytic ointments work very well. Simple sulfur ointment as well as sulfur salicylic ointment are very effective, and pure salicylic ointment also works well as they help remove keratinization. Diprosalic with Elcom C is also an option. That is, we assess each patient individually. We carry out the treatment as a course for about 10 days, and then we switch patients to natural ointments with tar, Ricard ointment, Soriaten ointment, in other words, to simpler ointments, Crotalin as well, so that the skin doesn't get used to glucocorticoids and can gradually recover. In addition to all this, of course, mud therapy is also recommended. Spa and resort treatment is very effective. The Kuyalnik Resort or the Dead Sea work wonderfully well. For the pustular form of psoriasis on the feet, ointments with a broader spectrum of action are recommended in order to reduce the inflammatory lesions. That is, this can be Lorindan C ointment, Tridem ointment, Trimestin ointment, our Ukrainian Darnitsa ointment, Triacutan and Celestidem B ointment with garamycin also works very well. So these ointments, since they are corticosteroid based, yes, they reduce inflammation, but at the same time they also work against secondary infections. And secondary infections can vary. They can be pustular or they can be fungal. So these broad spectrum ointments also work very well for these forms of psoriasis. And we observe very good results. For the plaque form of psoriasis, especially on the knees, when there are large, dense plaques, diprosalic ointment, Elcom C ointment, and Sarkatan ointment have proven to be very effective. So these three ointments work excellently. At first, for example, they recommend, let's say you start with diprosalic, right? Diprosalic for 10 days and then Sarkutan, or another option, Elcom C and Sarkatan, or another good ointment, Lorindan C and Sarkatan. So why exactly these combinations? Because in these three ointments, diprosalic, Elcom C and Lorindan C, there is also salicylic ointment, meaning salicylic acid is added to make it easier to exfoliate these papules and plaques. It exfoliates perfectly during this period over 10 days, especially if applied at night, preferably under an occlusive dressing. In the morning when you wake up, it all comes off much more easily. Then, for the next 10 to 14 days until recovery, the Sarkutan ointment is used. Very good results are observed. But again, of course, you should definitely consult a specialist. It's not advisable to do anything without a doctor. Well, this is one of the options that at the very least won't do any harm.